Hi everyone, this is group presentation one. My name is Azadeh Salamat and I'm going to talk about evidence-based practice in multicultural counseling. First, we want to learn what is evidence-based practice. Evidence-based practice refers to integration of three components: best research evidence, clinical expertise, and clients' preferences, characteristic, and cultural background. So, evidence-based practice and diversity. Evidence-based practice has gained increased acceptance in the field of multicultural counseling. Unlike empirically supported therapy, which relies solely on solid research data and randomized trial to treat mental disorder, evidence-based practice places a strong emphasis on understanding the client's characteristic, cultural background, preferences, and working collaboratively with the client to develop goal and treatment plan that meet the client's values and cultural background. According to evidence-based practice, the path to finding the most effective treatment is by understanding the client cultural background and consideration of which treatment plan more likely to yield the best outcome. So EBP, evidence-based practice, is kind of broader than ESC. ESC is just rely on research data, but evidence-based practice consider the cultural background of the clients, which really we care in multicultural counseling. So ACA 2014 Code of Ethics related to multicultural counseling, I could find four standards. Standard A to C emphasize on cultural sensitivity, effective communication with the client, considering the client's cultural background. Standard B1A emphasizing on multicultural and diversity consideration. Standard E5B cultural sensitivity, and the counselor should consider that culture affect the behavior and yeah, and take into account the client's socioeconomic and cultural experience in diagnostic medical disorder. And E5 especially talks about multicultural issue and diversity in assessment, and it emphasizes on the fact that counselor recognize the effect of culture, age, disability, race, language, sexual orientation in administration and interpretation of the test. So AACC 2014 Code of Ethics has different codes related to multicultural counseling. One standard or code 1-520 talks about Christian counselors should develop and maintain culturally competent awareness and knowledge of various cultures. In another code, it mentioned about working with the persons of different faith, religious, and value. Christian counselor respect all the clients and include clients' faith and value into counseling when it is important for client. Another one, code 1-540, talk about importance of Christian counselor communicate with clients in a culturally sensitive manner, especially when obtaining consent, finding the scope of the care, and during assessment and evaluation procedures. The other one, code 1-610A, it talk about treatment plan consideration and principles. According to this code, counselors should consider clients' preferences, characteristics, and socio-cultural factors, and seek to treat clients according to their worldview. They should consider all these factors. So Bible invite unity among all human races and appreciate the diverse culture. This align with biblical principle. Division is a consequence of sin, while the fruit of the Spirit is fostering togetherness and unity among people from various cultural backgrounds. In Revelation chapter 7, verse 9, describe people of various nation, tribe, and language coming together to praise God. The text also emphasizes that Bible teaches that factors like race, culture, and gender do not create division in God's eye. And the other one, Bible encourage cooperation and cultural norm as long as they do not conflict with God's command. This was my part. Thank you so much for listening to my presentation. And now we go to the next speaker. Thank you.